The interesting thing about this is that we have been so looking forward to the 19th, to so-called Freedom Day. As it approaches, there's considerable concern, and as the government has said, there is a risk here.
Well, we were warned in advance that the Prime Minister was going to tone down the rhetoric about Freedom Day, and boy, did he tone down the rhetoric. Frankly, I found what he's just said pretty disappointing. Not only has he said that he wants us to keep wearing masks in indoor crowded spaces, particularly on public transport. In addition, the government is recommending that nightclubs and other crowded indoor hospitality venues introduce a COVID pass system, essentially a vaccine passport. I mean, it wasn't, I think last week we were told that vaccine passports had been ruled out. Well, suddenly today they're being ruled back in, which is a big disappointment. And he also made it clear that this is not irreversible. He said in a Weasley way, the hope has always been. I've always said that I hope this will be irreversible. But actually that was more than toning down the rhetoric. That sounded more like a U-turn on the irreversibility commitment. Clearly, these aren't irreversible easing of restrictions. We know from papers published by Sage last week that, according to Sage, stronger measures may be needed in the autumn. We know the government intends to extend the Coronavirus Act into 2022. This isn't a terminus. This is just another way station. So I'm pretty disappointed.
But the facts would suggest that the government is right to urge caution because we're in another third wave. We don't know where it's going to peak. Clearly, this, and the Prime Minister said it, the virus is not gone.
The virus hasn't gone, but focusing on the number of people who've been infected makes little sense now in trying to determine what restrictions we should ease, because the vaccine program has largely broken the connection between infections, hospitalizations, and deaths. According to an NHS England data packet released last week, the percentage of total beds occupied in English hospitals by COVID patients is 1.5%. Even the Prime Minister said that the people dying from coronavirus is at the low end of the modelling estimates. We know because 85% of more than 85% of the UK population have been offered at least one COVID jab. Patrick Vallance said just now that by July 19th, every adult in the UK will have been offered a COVID jab, and 2/3 of the UK adult population will be double jabbed. Thanks to that successful vaccine rollout, and thanks to natural immunity caused by people getting the virus and recovering, and thanks to pre-immunity from the virus, I think we've now largely reached herd immunity. The connection between infections, hospitalizations, and deaths has pretty much been broken. So the number of people being infected isn't really relevant. What we need to look at is the number of people in hospital. And currently, 1.5% of hospital beds are occupied by people with COVID. So why not unlock?